of Manor Castle.
My Lords, I rise to move Amendment 46 and speak to Amendments 168 and 169 in my name. Now, in an earlier group this morning, we were talking about democratic accountability at the local or ICB level, particularly Lady Thornton's Amendment 23. We were also, through the agency of Lord Davies of Brixton's Amendment 45, looking at the risks that the people of England could be left without NHS cover. These were about ways in which this bill could go horribly wrong. Certainly, I have no doubt, going horribly wrong in terms of what the public want, if not necessarily unintended consequences in terms of how the Health Secretary and the Chancellor are apparently thinking of taking our NHS. Now, a couple of hours ago, the Noble Lord Hunt of King's Heath was talking about how the government is centralising power, the ICBs having to look upwards to the hierarchies above them. Indeed, he used the phrase, they're going to be beaten up by the centre. And as the Noble Lord was saying that, I was struck that a briefing actually arrived at that moment in my inbox from the NHS Confederation, NHS providers and the King's Fund, which was very much focused on that concern about the Secretary of State's power to direct. So it seems that this bill, it's clear that this bill, is going to give the Secretary of State enormous power to interfere potentially in the most minute aspects of healthcare locally, something that concerns a great many people. Now, this is something I think it's already clear that your Lordship's House will keep talking about and very likely in the future try to change. But we know we're unlikely to be able to entirely transform this bill and the relationships between the centre and the local. And so I would say that I come to a phrase that with power comes responsibility, and with great power comes great responsibility. I went looking for the origins of that phrase, and you can attribute it back at least to the revolutionary French National Convention or possibly to the King James Bible. And the fact that it is to be found in many political contexts across the political spectrum perhaps shows that it might be considered to be uncontroversial. So I'd ask the Noble Lord the Minister, where is the attribution of central responsibility in this bill? That's a serious question. Where does the Noble Earl the Minister think the responsibility of the Secretary of State to ensure that there is healthcare available to every person in England resides in the bill? Or does the Noble Earl the Minister want to say that such a responsibility does not exist? For if Americanisation steams ahead, and let's not forget that the US has astonishingly high healthcare costs, with results resembling those of countries with vastly less funds, who will actually be held to account for that? This is what this group of amendments seek to achieve, to ensure that the Secretary of State is responsible for the outcomes of the government's bill. What these group of amendments would do, would aim to restore the NHS in England as a public system, as it continues to be in the rest of the UK and as it used to be in England. Now, I don't want to get too far into the weeds, and Noble Lords can read the amendments and the explanations for themselves, but I'm aware that the text of the amendments is not particularly obvious in their meaning, particularly the first, so I'll briefly run through them. Amendment 46 replaces the word "it," which is referring to integrated care boards and specifically their duties, so that the amendment makes it the duty of the Secretary of State to commission health services to meet the reasonable requirements of the people for whom it has responsibility. That is, the Health Secretary having responsibility for the people in England. Now, Amendment 168 restores the wording of Section 1 of the NHS Act of 2006, giving the Secretary of State the duty to promote the comprehensive health service. It very closely echoes the wording that was found in the founding National Health Service Act of 1946. Now, Amendment 169 says that the Secretary of State must provide, to a level necessary to meet all reasonable requirements, services including hospital, medical, dental, ophthalmic, nursing and ambulance services. And I note particularly interestingly subclause D, which refers to the care of pregnant women and young children, which takes up some of the issues we were referring to in the first group today. On reflection, we could perhaps improve the wording of that, but it's certainly a start in terms of putting that acknowledgement of the needs of children into the bill. Now, again, the wording in both of these amendments reflects what was found very closely in the 1946 Act, and indeed in every Act up until 2012. Now, I think it's worth reflecting a little on why that wording disappeared from the 2012 Act. It was because there was a move towards market-based structures, and so we were relying on the market to provide. Now, that has in this case, as so many others, proved to be a disaster, and indeed I think in bringing forth this bill at this moment the government is acknowledging that disaster. And indeed, although the timing of this bill is very interesting, given, as I think both opposition frontbenchers have noted, it comes at a time when the NHS is really struggling to cope and yet facing this massive reorganisation. So, in summary, in terms of 168 and 169, I find myself in a situation I'm perhaps not in very often. I'm advocating to the committee that we revert to the old, the tried and the tested, the kind of NHS that there's bountiful evidence that the public actually wants. Now, similar amendments to these were moved in the other place, and that I note there was in the discussion there it emerged how in the 2012 Act there was a kind of compromise amendment, and this arose at least in part out of the Constitution Committee. The compromise wording was that the Secretary of State retains ministerial responsibility to Parliament for the provision of the health service in England. Now, I can't see similar wording in this Act, but it's long and complex, so I'd be interested in if the Noble Lord the Minister can point me to anything that he sees similar to that 2012 compromise. Now, in the debate in the other place, the Minister said, and I quote, this change was, quote, unnecessary as law. The Secretary of State has the duty to promote the competence of the health service in practice. He is accountable to Parliament for the comprehensive health service. Now, I think those words in practice are rather telling. We find ourselves in a situation, as we are so often, hearing from the government that, don't worry, things will work out, you can trust us, this doesn't need to be on the face of the bill. And I think that's something that Your Lordship's House very often expresses great scepticism about, I would say rightly. We want to see things in law to which the government can be held for account. We know all too well how creaky parliamentary accountability can be, how stretched and limited scrutiny Your Lordship's House can be, let alone in the other place, where 44% of the vote in 2019 delivered 100% of the power to the government. There is brilliant work done by select committees, there's brilliant questions asked by individual MPs to highlight issues. But the practical reality is the government can just ignore all of those things and bulldoze through, and very frequently does. Now, I note that in the other place the Minister further said, quote, we should be wary about being overly prescriptive in primary legislation, close quote. But surely being prescriptive about the fact that we have a national health service is what the public unarguably want. The government is being prescriptive about how it can control ICBs, can control local services. But I would say that we have to be prescriptive about what the government itself must do. That's a responsibility that we must live up to. This is surely not overly prescriptive. I beg to move.
Amendment proposed, page 13, line 28, leave out it and insert